How's it going, everybody? This is Dr. Job and Dr. Daphne with HealthFit, and we're here today to talk to you guys a little bit about what some of our patients have been complaining about more recently, which is, why do I feel neck and back pain as I walk? And for most of us in this day and age, we're sitting down for a long period of time. When we do that, we start to allow certain muscles to get really tight and engaged, and they don't like to release. When those muscles don't release, it's hard for us to be able to stand up straight. So if you've ever seen some of those people walking across the street, they typically end up being a little bit older, but they're just completely hunched over and they're just cranking their head back just to be able to get their eyes up and see. And they're taking one step after the other, and it looks so laborious and so hard for them, and it just breaks my heart. Because if you take that same person and you transpose them backward, it just looks like they're sitting down. And so the idea is we want to be able to stay nice and elongated as we're going through our walking, right? One of the concepts that we talk about a lot in the office is stay stacked. Keep your ear stacked over your shoulder, shoulder stacked over the hip, hip stacked over the knee, knee stacked over that middle of the foot or the back part of your foot. When we're able to stay stacked that way, gravitational load allows us to distribute that pressure a little bit more evenly through the rest of the system, so not one part of the system is taking all of the pressure. This allows us to actually engage our system a little bit more symmetrically, a little bit more evenly, so with every step we're able to build better balance instead of building degeneration. One of the big things that we'll also talk about after you get into that elongated state is being able to generate your power through your core and actually pressing with your leg in front of you. For most of us, what we tend to do is kind of lead with the shoulders. We don't want to lead with the shoulders, we want to try and lead with the hip joints. So there's one thing when we talk about our hip bone, it's another thing when we talk about our hip joint. Our hip joint is not our waist, the part of the body that has a joint the size of a tennis ball. It's made to handle a lot of pressure. When we're able to walk and engage ourselves through that joint, we're tearing away our glutes, we're allowing our quads to get work. All of a sudden, we're starting to get a lot more balance through our motion because we're using these bigger muscle groups that are made to handle that pressure. Instead of the alternative, which is creasing at the waist, leading with the shoulders and the head, putting the head back into what I call no man's land, where nothing's there to really support it well. And all of a sudden you see Daphne's face because she's starting to feel that headache come on. She's starting to feel that neck pain. She's starting to feel that asymmetrical balance, because that's also going to affect your balancing centers in the inner ears. So we want to get right back up straight again, make sure that we're leading with those hip joints and pressing in front of us. Now, what if you're not the 60 or 70 or 80-year-old that's not able to stand upright? How does this still affect you? Well, there's nuances to this motion. And so we say get stacked. And it might look like Daphne's stacked in a couple of these positions, but if you'll notice, if her hips start to fly back, all of a sudden she starts to crease through her low back, and she starts getting a lot more pressure through these tiny spinal joints that are the size of a dime, versus getting that pressure back into her hip joint. This is what I call the duck butt. Not because she quacks, but because her waist is completely behind her upper body, and she's having to balance her upper body using muscles that are very inefficient at that action. The opposite of the duck butt is what we call the old man suck butt, and that's when your pelvis is going into what's considered a posterior tilt. In this position, you're seeing how her shoulders are being driven behind her hips, you're seeing how her head is being driven behind her hips, and all of that pressure is going into her knees and into her ankles. Again, we want to try and redistribute that pressure a little bit more evenly by getting stacked properly. Now, if you typically notice with those shoulders coming forward, that's probably from years and years of going to school and wearing that backpack. If you find that you're not even able to get up into this position, nonetheless be able to recreate the rest of it, give us a call. Come on in. Let's see if it's something that we can help you with.